Stress is a common experience for adolescents, and it can manifest in various ways. Adolescence is a period of rapid physical, psychological, and social change, which can make it a challenging time for many young people. It is important to note that stress is a normal part of adolescent development, and not all stress is harmful. Mabuhay. I am Owen. In this lesson we are going to discuss that understanding stress and its sources during adolescence may help in identifying ways to cope and have a healthful life, identify sources of one's stress and illustrate the effect of stress on one's system, and demonstrate personal ways of coping with stress for healthful living. As such, prepare yourself to learn much from this lesson, and apply what you will be learning in your life so that you can become the best version of yourself. To prepare us in the discussion of the topic, here are the guide questions. Answering them will help in the understanding of the lesson. 1. What is stress? 2. What are the types of stress? 3. When is stress beneficial? When is it harmful? 4. What causes stress? What causes stress among adolescents? 5. How can adolescents cope from stress? 6. What is the nature of stress experienced by Filipino adolescents and their strategies in coping with stress? Take note of these questions and look for the answer during the discussion. With that you can be able to assess the level of your learning about the lesson. Let us begin our discussion of the lesson by understanding the nature of stress. Stress is defined as a physiological and psychological reaction to a perceived threat or demand that exceeds a person's coping resources. It is a complicated phenomenon that can manifest as physical, emotional, or cognitive symptoms. Stress can be acute or chronic, and it can be caused by a variety of factors such as work, relationships, finances, and health concerns. While some stress is considered normal and even beneficial, chronic or excessive stress can be detrimental to physical and mental health. Having defined stress, let us look into the types of stress. The nature, duration, and intensity of the stressor, as well as the individual's response to it, can all be used to classify stress. The following are some of the types of stress. 1. Acute stress. This type of stress is a short-term reaction to a specific event or situation, such as giving a presentation, being involved in a near accident, or getting into a heated argument. Once the event has passed, the symptoms of acute stress usually subside and the body returns to normal. 2. Chronic stress. This type of stress is caused by ongoing or persistent stressors such as financial difficulties, relationship issues, or job-related stress. Chronic stress can be harmful to both physical and mental health, and it has been linked to a variety of health issues such as heart disease, diabetes, anxiety, and depression. 3. Episodic acute stress. This type of stress occurs when a person experiences acute stress on a regular basis. People who have episodic acute stress tend to be irritable, anxious, and worried. They may also struggle with time management and have a pessimistic outlook. 4. Traumatic stress. This type of occurs when a person witnesses a traumatic event, such as a natural disaster, a serious accident, or a physical or sexual assault. PTSD can cause a variety of psychological symptoms, including flashbacks, nightmares, anxiety, and depression. 5. Developmental stress. This type of stress is associated with life transitions or events such as puberty, beginning college, getting married, or having a child. In conclusion, positive or negative developmental stress can affect individuals differently depending on their personal circumstances. Continuing on with our discussion, let us focus this time on the impact of stress to adolescents. Stress can be beneficial or harmful depending on the type, duration, and intensity of the stressor, as well as the individual's reaction to it. Here are some general guidelines to help you determine when stress is healthy and when it is not. Stress is beneficial when 1. It is short-term stress because it can boost motivation and focus in the pursuit of goals. 2. It is acute stress because it can boost the immune system and boost resilience. 3. It is mild stress because it can help you grow and develop. 4. It can allow the individual to better adapt to new and challenging situations. Stress is harmful when 1. It is a chronic stress because it can be harmful to both mental and physical health. 2. It is a prolonged stress because can wreak havoc on the immune system, increasing the likelihood of illness and disease. 3. It results in burnout, anxiety, and depression. 4. It disrupts daily activities and relationships. It is important to note that the effects of stress differ from person to person, and what one person considers healthy stress may be harmful to another. Having discussed the nature of stress and its impact, it is equally important also that we need to talk about the causes of stress. Understanding the causes of stress can help us deal with it. The causes of stress can be complex and varied, resulting from a combination of internal and external factors. Understanding the various types of stressors and their causes can assist individuals in identifying sources of stress and developing stress management strategies. The causes of stress can be classified into 1. Environmental causes. These are external factors that can cause stress such as natural disasters, extreme weather conditions, noise pollution, and air pollution. A person living in a hurricane-prone area, for example, may experience stress during hurricane season due to concerns about the safety of their family and home. 2. Social causes. These are interpersonal factors that can cause stress such as conflicts with family members, friends, or co-workers, social isolation, and discrimination. Example, a person may experience stress as a result of ongoing conflict with a co-worker or discrimination based on race, ethnicity, or gender. 3. Psychological causes. These are internal factors that can cause stress such as negative thinking patterns, unrealistic expectations, and chronic worry or anxiety. For example, a person may experience stress due to their tendency to constantly worry about the future or their inability to let go of past failures. 4. Physical causes. These are physiological factors that can cause stress such as chronic pain, illness, and sleep disturbances. For example, a person may experience stress due to chronic pain or an ongoing illness that affects their ability to perform daily activities. 5. Behavioral causes. These are stressors that arise from an individual's lifestyle or behaviors. These includes but not limited to smoking habit, excessive alcohol or drug use, poor nutrition, or lack of exercise. A person who smokes in order to deal with stress will not likely totally eradicate stress. 6. Work-related causes. These are stressors that arise from an individual's work environment or job-related responsibilities such as job insecurity, work overload, interpersonal conflict, or lack of control over one's work. An individual with no assurance of permanency in work would mostly experience stress because of the lack of job security. 7. Life events. These are stressors that arise from significant life changes, such as marriage, divorce, death of a loved one, or major financial changes. A death of a loved can not only cause stress but also great agony. Our discussion on stress continues, focusing this time on stress as experienced by adolescents. Adolescence is a time of significant change and growth, which can be both exciting and stressful. During this period, adolescents are dealing with various developmental tasks, such as establishing a sense of identity, developing social relationships, and managing academic responsibilities. The causes of stress among adolescents are varied and complex, and can be attributed to individual, environmental, and social factors. In this response, we will discuss some common causes of stress among adolescents and provide examples. Academic pressure is one of the most significant sources of stress among adolescents. Adolescents may experience anxiety and stress related to schoolwork and grades as they strive to meet the expectations of their parents, teachers, and peers. This pressure is especially intense during high school, when academic performance has a significant impact on future opportunities. Furthermore, the increasing competitiveness of college admissions and the pressure to excel in extracurricular activities can exacerbate academic performance stress. Another source of stress for adolescents is social pressure. Adolescents are in the process of developing their identity and sense of self, and they may feel compelled to live up to social norms and expectations. They may be stressed out about fitting in with their peers, maintaining relationships, and navigating social situations. The increasing use of social media and technology, which can heighten feelings of comparison, isolation, and disconnection, can exacerbate this pressure. Family conflicts can also be a significant source of stress for adolescents. Adolescents may have disagreements with their parents or siblings over issues such as discipline, communication, and differing values. Deteriorating relationship of the family members, financial difficulties, or illness can also have a significant impact on adolescent well-being and contribute to feelings of stress and anxiety. Another source of stress among adolescents is excessive use of technology. Adolescents spend a significant amount of time on social media and other digital platforms, which can lead to addiction, sleep disruption, and other negative outcomes. Social media can be a double-edged sword for adolescents. While it can help them stay connected with their peers, the pressure to maintain a perfect online image can cause stress and anxiety. Adolescents may feel the need to constantly check their social media accounts, leading to an addiction and taking a toll on their mental health. Adolescents also face stress related to body image issues. Adolescents may experience peer pressure to conform to unrealistic beauty standards, which can result in body dissatisfaction, eating disorders, and other negative outcomes. Adolescents may be self-conscious of their physical appearance and body image. This can lead to low self-esteem, anxiety, and even eating disorders. The pressure to conform to societal beauty standards can also contribute to stress and anxiety. In conclusion, there are many causes of stress among adolescents, and these causes can have negative effects on their mental and physical health. Academic pressure, peer pressure, family conflicts, excessive use of technology, and body image issues are just a few of the many sources of stress that adolescents may face. It is important for parents, educators, and healthcare professionals to be aware of these causes of stress and to provide support and resources to help adolescents manage stress and build resilience. Coping with stress is an important skill for adolescents to develop, as it can help them build resilience and manage their emotions and behaviors. In this response, in this part of the lesson we will learn some effective coping strategies that adolescents can use to deal with stress. 1. Mindfulness. Mindfulness is a technique that entails paying attention to the present moment and accepting one's own thoughts and feelings without judgment. This can assist adolescents in reducing stress, improving their mood, and developing resilience. Mindfulness can help adolescents manage stress caused by academic pressure, peer pressure, and emotional distress. 2. Physical activity. Physical activity is a stress management strategy that includes exercise and other physical activities. Physical activity can help adolescents cope with stress caused by academic pressure, peer pressure, and emotional distress. One of the most common physical activities that adolescents can easily participate in and has been shown to be effective in reducing stress is exercising. Exercise can help adolescents reduce stress, improve their mood, and boost their self-esteem. 3. Social support. Adolescents benefit from social support because it makes them feel connected and supported during stressful times. Adolescents can get help from friends, family, teachers, or mental health professionals. Adolescents can benefit from social support to cope with stress caused by peer pressure, family conflicts, and emotional distress. 4. Relaxation techniques. Deep breathing, progressive muscle relaxation, and visualization are some of the most common relaxation techniques that can help adolescents reduce stress and manage their emotions. 5. Problem solving. Problem solving is a coping strategy that entails identifying the problem, brainstorming potential solutions, evaluating them, and implementing the best solution. Adolescents can use problem solving to cope with academic and personal challenges. 6. Emotional regulation. Emotional regulation is a stress response coping strategy that entails identifying and managing emotions. Adolescents can use emotional regulation to deal with stress from interpersonal conflicts and emotional distress. 7. Cognitive behavior therapy. CBT is a type of therapy that assists adolescents in recognizing and changing negative thoughts and behaviors that contribute to stress and other mental health problems. CBT can assist adolescents in developing coping skills and resilience. To summarize, adolescents can use a variety of coping strategies to deal with stress, including mindfulness, physical activity, social support, emotional regulation, relaxation techniques, problem-solving, and cognitive behavioral therapy. It is critical that parents, educators, and healthcare professionals are aware of these strategies and encourage adolescents to incorporate them into their stress management plan. This lesson concludes with the discussion on stress as experienced by Filipino adolescents. Stress is a common adolescent experience around the world, and Filipino adolescents are no exception. Filipino adolescents' stress experiences are shaped by a variety of factors, including cultural, familial, and societal contexts. As a necessary consequence, they devise coping strategies to deal with their stress. Alfonso, Educado, and Reyes 2020 conducted a study to identify the sources of stress among Filipino high school students. The study discovered that academic pressure, peer relationships, family relationships, and future career plans were the primary sources of stress. Financial concerns and personal health issues were also identified as stressors in the study. Porrio, Javier, and Espina 2018 conducted another study on stress experiences and coping strategies among Filipino college students. According to the study, the most common sources of stress were academic demands, interpersonal relationships, and financial difficulties. The study also revealed that Filipino college students used coping strategies such as seeking emotional support from family and friends, participating in physical activities, and practicing religious and spiritual activities. Magtibay et al. 2020 investigated Filipino adolescents' coping strategies in response to academic stress. According to the findings of the study, Filipino adolescents used a variety of coping strategies, such as problem-solving, seeking social support, and engaging in leisure activities. The study also found that Filipino adolescents who used adaptive coping strategies performed better academically and had better mental health outcomes. Aside from these studies, Perez, Dan, and Lipid 2021 investigated the relationship between stress and academic performance among Filipino senior high school students. The study discovered a significant inverse relationship between stress and academic performance, with stress predicting poor academic performance. To summarize, stress has become an important issue among Filipino adolescents, and they develop a variety of coping strategies to deal with it. Understanding these coping strategies as well as the cultural context in which they occur can help in the development of effective interventions to assist Filipino adolescents in managing their stress. In summary, here are the key ideas you need to remember. 1. Stress is defined as a physiological and psychological reaction to a perceived threat or demand that exceeds a person's coping resources. 2. The types of stress are acute stress, chronic stress, episodic acute stress, traumatic stress, and developmental stress. 3. Stress is beneficial when it is short, mild, and has positive impact to the person. It is harmful when it is chronic, prolonged, and has a negative impact to the individual. 4. The general and most common causes of stress are environmental, social causes, psychological, physical, behavioral, work-related, and life events. 5. On the other hand, the most common causes of stress among adolescents are academic pressure, social pressure, family conflicts, excessive use of technology, and the body image issues. 6. Adolescents can use a variety of coping strategies to deal with stress, including mindfulness, physical activity, social support, emotional regulation, relaxation techniques, problem solving, and cognitive behavioral therapy. 7. Filipino adolescents' stress experiences are shaped by a variety of factors, including cultural, familial, and societal contexts. As a necessary consequence, they devise coping strategies to deal with their stress, which include but not limited to seeking emotional support from family and friends, participating in physical activities, and practicing religious and spiritual activities, problem solving, and engaging in leisure activities. Mabuhay. This Owen. Adjourning this lesson by encouraging you to apply the lessons that you have learned to become the best version of yourself.